Max, we are ready to go when you are.
What's up, everybody? My name is Max Boykin. Thank y'all so very much for having us today. This is the part of our final series of the Southern HIV Impact Fund. And this first conversation is to kick us off in what many of these folks have been a part of, and many other folks that are joining us. We're part of a State of the South tour, where we went across the South talking to folks and understanding what they were going through, what impacts that they want to see, and what do they want to change. And one of the impacts that we also clearly heard from folks was the impacts of what has been the attacks on our civic power. And what we're going to talk about here today is we understand that our civic power is under attack, but we're also talking about how we're fighting back. So we're also talking about how in which the intersections of civic power, healthcare access, and HIV advocacy in the South come together. And we are having together today a wonderful panel. Three folks, three Black women who I have been able to learn quite a bit from throughout my time in this work. Also people that have continued to show up in different ways, and continue to be leaders in this work in many different ways. So I'm gonna introduce a couple of our panelists, and then we're gonna go a little bit into a set of questions that we had set together that come from the lived experiences of folks that are going through what is going on in the United States right now, but also in understanding how in which, particularly in the U.S. South, how that is connected to the attacks on global South, how this intersections impact our different communities. And we're just going to have a conversation with, to me, three amazing leaders in our movement to talk about how in which we fight back against that. I hope everyone's cool to join us and be a part of this conversation. Please, for those that are with us on the webinar, in the Zoom, put your questions in the chat. And for those that are joining us on YouTube or Facebook Live, also put your questions in the chat. We'll try to make sure that I get a chance to see those different questions as they are coming in. We do want this to be a conversation. I'm gonna start off with introducing one of the co-executive directors of Positive Women's Network that turns 18 years old this very month, and someone who, since my very first time in really interacting and engaging with advocates in the HIV movement, was an important force, an important piece for this work. And she's also an award-winning public health strategist, a top-tier public speaker, a mother, and she's renowned for her continued work in this work. I want to give a big shout out to our first panelist, the Evany Turk.
Thank you so much, Max. I am happy to be here with this amazing panel.
Thank you so very much, Evany. And next up, this is a lawyer that I have seen continue to be a force for an organization that I know the Center for HIV Law and Policy has always been an important force in this. But Jada, her continued commitment to making that happen, continue to showing up in the different state calls, not just here in the South, but across the country, being able to bring this while also being an amazing mother, making sure that these aspects are brought in and bringing in the different intersections. I want to give a big shout out to the Jada Hicks.
Thank you so much, Max, for that wonderful introduction. I'm so happy to be a part of this conversation, and I can't wait for us to dive in.
Thank you. And last but certainly not least, someone who helped co-found what is Black South Rising, along with has been the Director of Health Justice at the Mississippi Center for Justice for many years, and has continued where she has been like a strong background on all of this, and been on this work since '08. One of the best folks to ever come out of Louisiana and make the way through Mississippi. I truly love it, and always am happy to see a call, or anytime I get to go down to Jackson and see the Linda Dixon. I am very appreciative. So just shout out and much love, and put some love in the chat for all three of these. But I want to also introduce the Linda Dixon as well.
Oh, Max, thank you so much. It's a pleasure to be here with these wonderful ladies and with you leading us in discussion. So I'm looking forward to us, as Jada said, diving right in.
No problem. And this was also put in here was that, yes, my name is Max Boykin. I am the movement director for Black South Rising, where we try to build Black political power through the intersections of healing and health. Along with that, I am also the manager of Save HIV Funding campaign, where we are honestly trying to be able to save as much of the HIV funding infrastructure, both here federally, but also globally. And I sit at these different intersections to also bring with this. I have three powerful Black women sitting behind me in these pictures, Nina Simone, Shirley Chisholm, and Marsha P. Johnson. And happy Pride Month to everybody as we continue to do this. And we understand that Pride was started through a riot, and we also understand the South has something to say. And with that, I'm going to kick us off with our first question. With a constant federal defunding and attacks around what is the HIV sector right now, and with also seeing what is going on with the attacks around the Voting Rights Act, our access to voting, what do you see most at risk for folks in the South right now? And who do you see is definitely being left behind in these conversations?
I don't mind starting. What I see most at risk right now is the HIV safety net. Just the network of like care, prevention, housing, food access, transportation, trusted community organizations that keep people alive and connected. Those things are all at risk right now. And the people that are always left behind are the people who are pushed to the margins: Black women, transgender people, low-income people, rural communities, people aging with HIV, people without stable housing, undocumented people. This leaves people, afraid to engage in systems. And in the South, these systems were already under-resourced. So funding being cut creates even more of a delay. It means people are already missing medications, not getting the medications, not getting to appointments, not eating, choosing between do I eat or do I take my medication? People are disappearing from care. All of these things are currently happening because of what's happening and that's what's at risk right now, in my opinion, and what I'm seeing.
I think it's hard also to pick like what's most at risk, because it feels like we are under attack from so many different angles and so many life-saving services and supports that people truly and genuinely depend on are at risk, have already been cut, or have had delayed funding to the point where the services are interrupted because there has been this delay in funding. But I also want to say, I think it's really important that we note we're really dealing with a loss of crucial infrastructure as well. And dive down to the layers of what that means, right? So like if there are funding cuts, there's going to be staffing reductions. That means people are really going to lose like care coordinators, peer navigators, case managers, community health workers, people that they have developed trusted relationships with and who they rely on. And so when those relationships are disrupted, it makes it harder for people to navigate these complex systems and stay connected to care. And not only that, but it's really difficult to rebuild those relationships and rebuild that trust that people have been able to build. And so I really think not only is it just like the loss of services, it's also the loss of the safety net, as Evany said, it's the loss of the infrastructure. We're really risking this broad erosion of trust in public health and at a moment when it's already fragile. And I want to echo that, of course, the folks that are already and always pushed to the margins are going to continue to be pushed to the margins. And I think that's what we've seen. That's of particular concern in the South, especially for Black folks, that we're going to see interruptions in services, in treatment access, and in connection to care.
So in addition to what Evany and Jada just added, I want to just say that when you look at from funding aspect, funding fuels the safety nets. And we know that there's been a huge disruption. We know that legislation has been passed and signed into law that erodes at the very safety nets that's designed to help support people. So in addition to those things, what I see most at risk is everything. It's hard to say just one thing. When you look at the healthcare infrastructure, the closure of rural hospitals, and in particular Mississippi and other parts of the South, where hospitals are closing, or there's a reduction of badly needed services by everyone in the community, and that's a problem. Workforce development is disrupted because the lack of funding as well and resources. Who's affected? Black people living in poverty, Black people with transportation barriers, Black people generally due to a lack of resources and even transparency in safety net protections that are even here. What's left? What's not been taken away or not funded? What type of activities are being held to make sure that people understand what is available to them? So I think all of those things are of issue and concern, and not to forget during the pandemic and unwinding of the Medicaid and other resources, people didn't even know that they still had access to healthcare, to health coverage. So, transparency is huge.
Thank y'all also very much for taking time to answer that first question. And y'all gave me a couple of things to touch on, and love for y'all to just elaborate more for some of the folks on the call, but also the understanding what is also at stake at this time. And we all talked a lot about the changes to our safety net programs and what folks have. And I just got off a call earlier where folks are continuing to battle for what is full access to the ADAP program in Florida. And because of a lot of advocacy from folks have continued to make that possible. But on the other end, we're also now hearing updates from Texas, from Georgia, and others around a potential added to wait list and or cuts to their ADAP services. And we also saw a cuts to RYB per services in Missouri. What changes, especially Evany, that you've heard on the ground, and what that means for folks, especially like in Florida, when they deal with these the potential of changing in their safety net programs? How does that change their ability to continue to live and move forward? And then what are some of the things that y'all have been able to do to try to fight back against that?
Yeah, so it's not potential, it's actually happening. I was on a call with someone last night who lost their coverage and hasn't had medication in 2 months, and is trying to figure out how to get it, which also means that they haven't had their mental health meds in months, and it has led them down a very dark path. And that's what we're seeing. That's what we are experiencing, people losing their health coverage, because some people didn't even realize that they were being covered by ADAP because it was being called something else. So when they were losing their coverage, they really didn't understand. They heard about ADAP, but didn't know it was connected to what they were using. So people are actively losing care, actively losing, as Linda said, whole clinics in very rural areas. Their services are being transferred to the major cities where they have to travel an hour or two to get to a clinic to get services, which a lot of them don't have the transportation to do that. Gas prices have gone up, and people are needing gas to get to their appointments or even to get medications, because a lot of their pharmacies, a lot of them don't even have pharmacies in the area. So it's happening now. One of the things that, we've done a lot of things, but on a very ground level, one of the things that we've done to try to support people living with HIV in these areas, it restarted what we call safety pods. Is where we connect people in the state. They join a safety pod, and everybody is able to talk together and get resources to each other or share resources and help each other out. We always say we're the only ones that are going to save ourselves. So in that light, we are connecting people to support each other, share resources in the same space. One of the things, you may not be able to get medicine from the clinic, but somebody might have some extra or something. So, we're just trying to share resources where we can to get people the help and the support they need. Somebody might be able to share a ride to a clinic. Those things are happening. So that's on a very ground level what we are doing to try to support people to get what they need, stay connected, and get to save their lives, literally, because the conversation I had last night was like a life-saving, like a life-changing conversation. And I assume we will have more of those. And I'm glad I was even able to have that conversation, because I'm more afraid of the ones that I can't have.
Evany, thank you for that. Thank you for always your continued service and the things that we aren't able to talk about as much on the surface level, that we don't get into some of these like larger meetings, and we're thinking about systems change. We forget at times at the individual level and what is necessary to make these things happen. So one, thank you for uplifting that story and making sure that we understand what is really at stake when these very fragile systems, as was pointed out, how that just a simple potential change then leaves people without care and leaves people without what they're needing to have. Next question for the panelists, and this is open to everyone, is, as we talked about, there's these attacks on democracy that are going on, along with this tax on our actual ability to have health equity. And I've talked about this with like Amari and some others, and it's like this decriminalization, was increased criminalization on folks that look like us, while taking away the safety net and the health apparatus. So how do y'all see and the connection between democracy and health equity? And how do y'all make the connection for other folks in your communities of your access to health is actually directly tied to your access to democracy?
So I love this question. It also immediately, when you're asking the question, Max, I always think of people who always respond like, "Oh, I don't do politics. I'm not political." And it always makes me like, you should be. Because a lot of times people do think of these issues as completely separate issues. You can do that for a lot of different things when it comes to like the democratic process, but specifically in reference to health equity, right? What we already know is that the communities that are going to be most impacted by HIV and by HIV criminalization are going to be those same communities that face barriers when it comes to voting, political participation in general, and representation, right? So Black people, immigrants, people who use drugs, people who engage in sex works, those are the folks that are going to be impacted and affected, not only when is the gutting of, say, like the Voting Rights Act, but also when it comes to health equity. So when we as people, as a community, have less power and less participation in the democratic process, we then in turn have less power over the decisions that shape our lives and that shape our health, right? So like there's not going to be any influence over healthcare policy, funding priorities. We've talked about housing policy, criminal laws. So democracy is health equity. And if our communities can't meaningfully participate in decision making, it makes it easier to ignore us, to ignore our needs. And actually, we have examples of how democracy affects health equity. So in preparing for this webinar, I was doing some research and I came across a study from the University of Massachusetts Amherst. And in that study, what they found is that gerrymandering in North Carolina resulted in reduced access to healthcare services. We already know that, right? But we now also have studies that show what we know. And in fact, the research there was saying that the findings were consistent with the hypothesis, excuse me, that gerrymandering weakens local political representation and can lead to reduced access to vital healthcare services, right? So all of these issues are interconnected. They are not siloed, and we really need folks to start thinking about things in that way and not thinking that they're not political, that they shouldn't engage in the political process, because things like access to your medication, ADAP services, that's political. So, access to medication is political. All of this is political. And so I think people really need to start reframing and rethinking what they think of as political. And I think that's a part of the conversation where we really have to invest and educate folks.
Agreed. And I'll jump in, they're deeply connected. Democracy is about ensuring that everyone has a voice in these decisions that affect their lives, right? Health equity is about making sure everyone has a fair opportunity to achieve the best health for themselves. And you cannot have one without the other. They're one and the same. It's one of the conditions, democracy is one of the conditions that makes health equity possible. The same systems that determine whether someone can vote, have their voice heard, or even influence policy, determine whether you have access to health care, adequate transportation, safe housing, clean water, environmental factors. They're all deeply connected. And when I think about that, when Jada was speaking just a minute ago, I was checking off the boxes of the social determinants of health because it's all affected in one and the same. Decisions that are made by policymakers, whether, families have access to health care, whether they can afford their prescriptions or maternal health services or the prescriptions that you need, or even keeping a rural hospital open, like we have in the South and in Mississippi in particular, are all related to policy. And one example, I know we're going to talk about this a little later, is expanding Medicaid. When we look at in the South, that 10 states, and namely, I think 8 are in the South that have not expanded Medicaid to draw down federal money that would help not only provide health care for thousands of people, but it would also help to strengthen the healthcare infrastructure with the influx of the federal dollars that would come in here to, we talk about job creation, supplies, hospital closures. It would help with that. And just the overall health and well-being of the citizens. So that's for sure directly tied to policy. You can't have one without the other.
And I would just say, democracy is definitely a healthcare issue, and healthcare access is a civic power issue. If the decisions that determine who has access to all of these things that have said, healthcare, medication, housing, funding, who gets elected matters. Who votes matter. Who serves on advisory boards matter. who gets invited to the policy decision maker tables matter. And Linda and Jada has said a few things already about a few issues, but I'm gonna kind of talk about representation because as a woman living with HIV, I know that when people are absent from decision-making tables and spaces, policies can look good on paper, but they fail in practice. So democracy isn't just voting. It isn't just it matters who has a voice. It matters who's heard. It matters who's represented. Those experiences and whose experiences shape policy. If we're not there, I can't talk about what matters to me as a Black woman living with HIV in Texas. So we have to be there. We have to be a part. We have to have our voices heard. We have to ensure that we are at the table and that there are people at the table that represent us. So it 100% matters.
Thank you so very much all for taking the chance to answer that question. I also want to address one of the questions in the chat, and we will try to address all of the questions as we continue to go through this. So continue to put questions in the chat. We may not, because we're trying to wiggle through the agenda while also being responsive to everyone in this. And so, yes, to quickly answer some, so could states still expand Medicaid if they wanted to? Yes, many of these southern states do not have the political will. Given to what Benita is also referring to within this, to actually push for expansion of Medicaid, but they could. But there also has been a constant erosion of what the Affordable Care Act was when originally pushing to make it a shell of itself in many ways. And it makes it harder for us to be able to then curtail that. And I want to come back to a piece before getting to some of the other questions also I've been chatting here, was also the importance of the ways in which people talked about the social determinants of health in the space. And the social determinants of health have become like, in some ways, a catch-all for a lot of the things that are going on. And one of the important parts for this the State of the South tour and understanding that the social determinants of health are very important, and a background of our understanding of how in which we further address the HIV epidemic, that the political determinants of health, which was written about by Dr. Dawes at Morehouse School of Medicine, which Benita had did a wonderful job of also actually expanding on it as part of our State of the South tour, is the political determinants of health look at the forces that have led to the social determinants of health and involves the systematic processes of structuring relationships. A lot of them we think about these elected officials, but Evany also brought up some important positions for us to think about in this is also county commissions. Who leads your Ryan White Planning Council? How and which different organizations or individuals have the ability to make structural decisions within this? And then Dr. Dawes also put in within this is that healthcare professionals take actions on how in which our political determinants of health because of how in which they are or not culturally responsive, and they use their implicit biases, aka their racist ideas and ideology, when that comes into the meetings that we have from the structural levels of a hospital system or a healthcare system to the individual conversation with just being able to talk to someone if they continue to take their meds. And this can also even be talked about in the ways in which the infrastructure is then used for people to get access to the things that they need after that. And with all of that, and me talking through a couple of these pieces that we also wiggled through to the tour, during the tour, we learned that the Voting Rights Act was going to be severely gutted by the Supreme Court decision. And with this also continued attack with the One Ugly Bill that has also been talked about, and further erosion of our healthcare access, what actions do you advise people to be able to take at this time? And how do people navigate with these multiple attacks that communities are taking to be able to decide what is the best action to take right now? And that's open to everybody. And if y'all is like, Max, that question didn't make sense by the end, let me know.
It makes sense, Max. First thing I would say is to just encourage people to stay connected. I love Evany's idea about being on advisory boards and things of that nature. Representation matters, as well as there's a lot of room for advocacy around implementation of the laws and rules and things that we do have to make sure that whoever the powers that be is doing what they're supposed to do when laws are passed. So that's one of the things. Second, I think just to recognize again that democracy and health are deeply connected, and to approach it from that way. And looking at decisions that provide greater access to healthcare, to medications. I mean, there had never been a waiting list for ADAP, and all of a sudden now there's a waiting list. We know that the safety nets they're being eroded with the voting rights. So watching that out carefully, and just encouraging people to invest in local leadership from the top to the bottom, and have local solutions that really make sense for people in community, that they know who to go to, or that it's not far from them. People have transportation issues. So to really think about some commonplace solutions to help, which we hope would be temporary situations. And then, I think it's really important to remember the power of storytelling and data, and how that plays out in the work that we do. A lot of times, folks will say, well, lawmakers and policymakers, well, who is this person? Who is this person who needs HIV medication? Who is this person who needs SNAP? So to be able to, and I'm really protective about the sanctity of people's experiences. They're not just stories. They're the lived experiences of the people that we serve. So to protect that in a way that's not, I would say, harmful and traumatizing, but to be able to, paint that picture of, what happens when people lose healthcare, what happens when a hospital closes, and the impact. And it's not, if a hospital closes in a city or county, whether you have health insurance or not, that's going to be a problem. So to make people understand that, to look at the big picture, and not just, in a narrow way. So those are the things I would suggest.
And I would say we have to understand that all of these attacks are exhausting. So we have to kind of organize against despair and make sure that we are not asking people to fight everything and everything alone all at once. Give people clear things that they can do, clear lanes. Some people can call legislators, some people can show up at the state capitol, some people can share their story, some people can register voters. There are multiple things that people can do. We just want to make sure that there's a lane for everybody. And all of that is a part of the fight. Everybody who wants to support or help, there is a lane for everybody. And the goal is not for everybody to do everything, because that is exhausting. But everybody should do something consistently, collectively, and with care, because it impacts every single person in our community. So everybody should be doing something.
I just wanted to quickly add on to that too. But I think to Evany's point, like really people should be looking at what they can control within their own sphere of influence, right? Because it is really overwhelming. And we have to be honest that it's also hard to effectively organize when we're operating from a place of crisis, which unfortunately we are. And so I think part of that is really what Evany said about if you can join a local organization, like that's what you can do. If you can support mutual aid efforts, then do that. And I think mutual aid right now is really, really important and particularly important because we really have to be able to rise to the moment and meet people where they are. And, sometimes what that looks like, that might look like just contributing money to a community fund. If that's all you can do, that's all you can do. If you could help your neighbor by driving them to their doctor's appointment, that's something. So literally anything that you can control within your sphere of influence, that's really what you need to look at. And then I also think and really want to stress the importance of trying to engage in the policy process where you can, right? So a lot of us are in this space and we do need to continue to show up when we can and effectively show up where we can because I'm not saying that advocacy requires you to be a full-time organizer. That's not what I mean. But I just mean consistently showing up where you can. And what that looks like is going to look different to everyone. As Evany said, that might look like attending council meetings, right? That might be like engaging with your legislators and doing some sort of education about harm reduction, about decriminalization for HIV. I really think folks should be engaging as much as they possibly can at the moment with their legislators and really expressing what priorities are important to them and the supports that they need. Like, how can we get that done? And how do we educate legislators on why we're asking for that, why it is crucial, and why it's life-saving? Really trying to identify those allies and build them up to introduce legislation that's going to support the priorities and support you and support our communities the most. I really think that that is crucial at this juncture.
I just want to add, and I was chatting with Benita in the chat there to acknowledge that my comment, it's widespread. We know in some places it's not, but it's getting worse, the access to drugs. That was my intent, is that it's getting really bad. And I know in some areas it's been something else. So yeah, it's getting worse.
Yes, sir. Definitely. And we're continuing to see this. Utah, as we talked about Georgia, Texas, updates from them. Missouri has already gotten rid of the RMYP or reduced the RMYP, and we will continue to see that as we continue to see the One Ugly Bill, or HR1, be implemented at the end of the year after the election. And some of these things are also around timing and how they also implement our people. One of the reasons that HR1 has been implemented to impact after the November elections is so it would not impact, people wouldn't see those drastic cuts and all those cuts in their healthcare access until after the election and see those increase rising. But we've already actually started to see those increases. And as our communities, particularly people living with HIV, seeing the lack of access in their care, but also I would even say, and for those that work in harm reduction and other access to work, of lack of the change of access to resources for them is making it harder for them to be able to do their work, while also seeing this barrage of attacks on access to voting and access to other things. One of the things that Benita had talked about during the tour was this Project 2025's implementation and the thought process around putting that into place, and how it has been, in a very short period of time, many of the things highlighted in that have been done, including attacks on the education system, our attacks on healthcare systems, our attacks on civil rights, and so many other different attacks that they have continued in different communities. But we've also seen on the state side where some of this has been already gone. They've already put a lot of this work in. And we're already seeing, and they're doubling down on even some of the packs of Project 2025. How is it showing up where you're seeing this, either on the state side or in the civic engagement or policy shifts that y'all are working on? And so how is that showing up for y'all in your work and in your states? And what are some of the legal ways to push back against this?
So I think some of this has been touched on a little bit, but of course we're seeing the aims of Project 2025 being used in efforts to eliminate or reduce programs that are focused on health equity, that are focused on LGBTQ plus communities, that focus on racial disparities. And some of those community-led public health initiatives have been completely gutted and cut. But like even more worrisome than that, we're really seeing, and what we've seen under this administration are like attempts to even restrict the language that organizations can use. And so the trickle down effect of that is that it then will affect like what populations those organizations can serve and prioritize and the types of advocacy that they engage in, right? Like I remember being at a conference and an organization was talking about a trans organization. Well, I don't even think we should say trans on our website. So kind of like preemptively making that adjustment. And I'm like, well, how are you going to get information to the communities that you serve when you don't even specifically name those communities on your website? But the fear was really motivating them to preemptively try and change their website so that they wouldn't attract any sort of unwanted attention, which I understand. But I think we've seen more of that in terms of organizations trying to shift like which populations they're focusing on, or at least outward or publicly facing which populations they focus on as well. And I think for those of us that work in the HIV space, it's particularly concerning because we know that the epidemic doesn't affect communities equally. And so in order to effectively respond to the HIV epidemic, like we have to talk about race. We have to talk about sexuality, gender, poverty. We have to talk about housing instability, all of these structural factors that really shape health outcomes. So when policymakers try to prohibit those conversations, they're essentially making it harder to address the epidemic. And from a legal perspective, in terms of like what sort of pushback we've seen, we've seen litigation. So we've definitely seen a lot of litigation, challenging unlawful funding terminations and cuts, attacks on federal agencies, and a lot of litigation about the rollback of some of these civil rights protections as well. And what's unfortunate about that is by the time you get a case to the point of litigation, the harm has already occurred. And so we're not going to be able to go back and undo the harm that has occurred, but we're reactively trying to do what we can to save these programs and to make sure these protections uphold. So I know I've kind of touched on like engaging in state level advocacy, but this is why I really think that like state level advocacy and coalition building and our community power is so important. Because I think when we really have those strong foundations, it makes it harder for them to dismantle them. And the other thing is just that I don't think Project 2025 should be viewed as like isolated policy ideas. It really is reflective of broader governance that relies on restricting bodily autonomy, trying to concentrate power and weaken public health institutions, and limit protections for marginalized communities and further marginalize them. And so we see that theme of like attack on all levels. So like on LGBTQ rights, on reproductive rights, on voting rights, on disability rights, on immigrant communities. So our response also really has to be interconnected, because I think the implementation of Project 2025, unfortunately, has been a success for them.
Thank you, Jada, for that breakdown. That was really good. And like actually taking time to actually think, I was like, this impacts our systems in so many different ways. And even the fear. The fear has actually been something that I've noticed the most of it, even before the full implementation goes into impact. What are some of the ways that y'all have been able to like legally or in any way try to push back against these continued attacks within the creation of Project 20 or the the full implementation of Project 2025. Can y'all talk about any of like the ways in which y'all have tried to counter either sue the government, sue states, and or other forms of pushback? And thank you, Jada, for naming a couple of them that we're going to talk about a little bit later in the call. But I wanted to give space for that as well, for the legalese of it all.
You know, Jada did a great job laying it out and touching base on a lot of these things. The decision out of Louisiana, that's one. When Section 5 of the Voting Rights Act was gutted out, that was the beginning of not creating greater access to voting, knowing that we don't have that protection for the Department of Justice to come in and make sure that elections are being run the way they're supposed to, and that they're transparent and people have access to the polls. You know, when we talk about just commonplace things, people are tired. They are worried about how they're gonna put food on their table, how they're gonna get their medications. They're worried about their children's education. I mean, it's a lot of different things. So, you know, I urge us to continue to prioritize that, because we know that democracy is tied to just about everything, including all the things I just said. So I think, you know, we're going to see a lot more creativity around what that looks like from a legal standpoint. And I agree that we shouldn't just look at 2025 singularly, because it is just masterful the way it was done. And even looking at the Rural Transformation Project and the funding there out of HR 1. So I know we're going to talk about that, but I just wanted to use that as an example.
Thank you so very much, Linda, for expanding on that, and also, again, Jada, for even giving that background, and also understanding. And folks who don't know, Project 2025 was a document created by the Heritage Foundation during the Biden administration in response to what was the pushback and what happened during after Biden's time in office, to then push back and have Trump and a lot of the policies that we are currently seeing pushed now. And that was a big part of that. So with these continued pushes and continued politics around like these punitive policies, which include HIV criminalization laws and others, and so they're suppressing civic engagement, or also taking away people's health care, and they do this through fear-based approaches. How do y'all fight back against the fear? And what do y'all see as something that is potentially like stronger than the fear to push back for our communities to organize with?
I think we fight back against the fear by just trying to be truth tellers as much as possible and share accurate information, inform people of what's happening and how it impacts them. Of course, organizing. We continue to do integrated voter engagement work, going door to door to talk to people about what's happening in their communities, calling people on the phone to talk to them about what's happening, and to invite them into community to help, because it's going to take all of us. Jada laid it out beautifully, that, you know, legal things are legal things, but as they are succeeding in what they plan to do, community power is going to be and is really important right now. As a community, we have to get together and fight back. So I think the way we push back against the fear is to not let them scare us to silence. We have to be verbal about what's accurate, what's true, what's real. We have to share that, continue to correct people when they are sharing inappropriate information, and just continuing to stay out there moving and working in community, because this is happening now. But as Linda said, you have to think about the whole, what's going to happen now and in the future. And things won't always be like this. I'm optimistic to say we will change things, but we have to get through this first. And we have to learn from this. That's the most important thing for me. What are we learning from this? And how are we going to implement the things that we are learning so we don't end up back here again?
So fear is a really powerful tool for exclusion. That's what it's designed to do. When policies are designed to punish, stigmatize people through restrictive voting laws that we've seen, and immigration fears and HIV criminalization, people are likely to just say, you know what? I'm just going to throw my hands up. I'm going to withdraw from systems that's supposed to serve and help and protect and provide a safety net, and be less likely to seek the help that they really need, and less likely to engage from a political standpoint, and even to speak out. So, people with HIV may avoid treatment, or, because they fear stigma or legal consequences. Folks may not apply for health care who need it because of the same. So, communities that have historically, Black communities that have experienced discrimination, we don't want them, of course, to disengage. This all, as we started our conversation off, is a barrier to health equity and democracy. So we fight fear by making sure people know their rights and understand the systems that affect their lives. We fight fear by creating spaces, and Evany spoke about this, where people can share the experiences, where they can be heard, where they can share resources. So turn that fear into fight, right? When people understand that their voice matters, that their concerns matter, that their lives matter, they'll be more likely to be engaged across the board.
I love that turn fear into fight, because I think fear is easy. It's an easy emotion to have, right? It's understandable, but it's easy. And I think it can't be overstated as well that I think a response to fear is like, continue to exist, continue to live your lives out loud, right? I know we often hear like the very act of your existence is resistance, but it is never more true, I think, than in this moment. So even like small ways to combat fear, right? Like whenever I'm out and about, I'm wearing an HIV advocacy shirt. I want somebody to talk to me about it, right? Like I want to spread the education around HIV and HIV decrim. So I think that's another way to combat fear, is by educating. Because if we're really being honest, a lot of these policies, and specific to HIV criminalization, like a lot of these laws are a result of fear and stigma, and then codifying that into the law. And I think one of the ways that we can combat that is by educating folks. It's easy to think of someone as the boogeyman when you know nothing about them. And I think, Evany, you kind of touched on that with storytelling, right? It's very easy to other people, but it is harder to do that when they're sitting in front of you face to face and telling you their story, and sharing that. So I think there is truth and power in that storytelling and in that education of folks. So I think that's a really big way that I see in my own work that I carry to combat and fight against fear.
Thank you all so very much for taking time to answer that question and how y'all fight back against fear. Love this, why Michael, turn that fear into fight. And it actually made some, because two parts, there's like one of the things that y'all have talked about is the importance of coalition building, coming together, and that is a way in which we will push back. There's actually a shirt that comes actually from earlier parts of me, part of the SHIF Fund, Stronger Together. But with that is also, I think about this, I know we talking about the South, but the southern tip of Mississippi is Chicago. And I met Evany there many years ago. So from an activist there, he said, "You don't fight fire with fire; you fight fire with water." And we don't fight, fear with more fear. We also want to. We don't fight racism with racism. We fight with solidarity. And so those are also like important things that we want to think through and think about. And that activist is Chairman Fred Hampton of the Black Panther Party. And it's an interesting piece because we're talking about also healthcare access, people's access to care. What does that look like? How does it expand? And one of the things that was brought up here was Medicaid expansion, and how that impacts our ability for care in the South. And we know there's a lot of access points, and part of the reasons that we're dealing with these ADAP situations is partially because a non-expansion of Medicaid in a lot of these states. I also heard an important leader within the HIV movement during last week's 7 Days in June Week of Action on a Defend Public Health call talk about the need for universal health care. With our inability currently to have healthcare in that light, what do y'all say we do about the states in the Deep South, especially the ones that haven't expanded Medicaid, or the ones that have work requirements, or the ones that make it harder for people to get access to healthcare, or are cutting ADAP programs? What should folks do, especially for these states in the Deep South that are impacted by this? What should folks do when they have so many points that are making it harder for them to even get access to care?
I'll jump into that one, which is that's a loaded question there, Max. The reality is in the Deep South, Medicaid expansion remains one of the most significant unfinished health equity issues. It's clear, we know that in states that have expanded Medicaid, the folks have had greater access to health care and so many wonderful results as a result of that. So when we think about what's happening in the southern states, millions of dollars, we're talking about millions of federal dollars, continue to be left on the table, right? While working families, people in rural communities, the majority, we have a lot of Black people living in the South. So what does that look like, right? And hospitals are continuing to struggle. It's getting harder. When it comes to the 10 non-expansion states, we have to continue to make the moral case that this is a racial and social justice issue, as well as an economic issue. Let's talk about some money. Let's talk about workforce development. Let's talk about saving families hundreds of dollars, preventing bankruptcies. People are having to choose between bread, milk, and eggs and healthcare. No one should go without healthcare in this country. We've seen, of course, preventive care has increased, and even the reduction of medical debt in states that have expanded. In terms of the work requirements, I mean, most people, Medicaid recipients who can already go to work, they're already working. So that's a huge, it's like, really? You don't think people are working? They're struggling. They're working 2 and 3 jobs to make ends meet. So that, work requirements do not create jobs. Expanded Medicaid is going to create jobs. What it creates is administrative barriers that cause eligible people to lose coverage. Either, they're not being getting a redetermination faster, or whatever the case may be, but we know that there's administrative barriers. And we should be focused on removing those things and not creating new ones.
And I just want to point out too that there's actually evidence that the work requirements don't work or aren't needed. If you look at Arkansas's pilot program, where they piloted the work requirement, over 95% of enrollees had already met that requirement. So just to kind of drive, yes, that is definitely a throwback, but just to kind of drive Linda's point home, that most of these folks are already working, and they are scraping by, and they need that Medicaid coverage so that they don't lose healthcare access. And I want to stress too, like, one of the things about Project 2025 that makes it unfortunately such a success is the impact that it already has on our communities that may already be experiencing, say, like housing instability, poverty, underinsurance, or no insurance. It took me a very hard time to like swallow this pill that like, oh, the whole point is they want us disconnected from any and all services, right? Like they want us to get sick. They want us to die. And so I think every step of the way, like what we're seeing is another avenue for them to do that, to try and confuse folks, because I think that's the other thing too. Medicaid is very confusing. It's already confusing. Without having to add anything else in, it is very confusing. For folks on here that have had to fill out a Medicaid form before, when I filled mine out for my daughter, they had to call me, ma'am, you messed this form up so bad, we are calling to get clarification. And so not only that, the requirements are confusing. And so I think that's another tactic that they're using, is to create this confusion, because sometimes folks that are confused, they may not follow back up. If you're worried about your house, it's very, and whether you have food to eat, it's very hard to think about these application requirements that you have to satisfy. It's very hard to be able to digest what the change actually means for your situation. And I think all of that is intentional. So just trying to kind of name that as well.
Only thing I'm gonna add to this is that, not expanding Medicaid policy decision that has human consequences. And what we hear a lot is, these people don't believe in big government. They believe states should, have these decisions, yada, 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 yada. They doing all of this just to suck the money away from us. So my only thing to add here is please, please, please get involved in civic education, because who we put in power matters, as we can see. It is really important for everybody. Like hold people accountable, hold your family accountable, hold your friends accountable, hold your kids accountable. Because us not getting involved, us not knowing who we're putting in power, us not engaging into voting, us not doing these things, it's the reason why it's not really the direct reason, but it's the reason why we have these people in power. And who you put in power and who we put in power impacts our health and every single thing else about who we are. So just please engage. That's the only thing I have to add to what has already been said.
Thank you so very much, all of you, for doing that. Linda, I saw that you wanted to add something to that.
And a part of being engaged is watching what happens when we do get federal dollars. The Rural Transformation Fund project that's coming out of HR 1 to help strengthen the rural hospitals. We got, and I'll speak for the state of Mississippi, over $200 million are coming into this state. Where's the transparency? Where is it going? Who is it for? I mean, we need to know all these things. And communities where the hospitals are either already closing, already have a reduction in services. I mean, so we take this federal money, but we don't take the Medicaid expansion federal money that would actually put people into care. It makes no sense to me.
Thank you so very much, Linda, for that additional piece, all of you, for answering that question and being able to talk about the cruelty and what happens with this healthcare access piece. As we shift in for the last quarter of this presentation, one of the things in the question that came in the chat, and I do encourage everyone to ask questions in the chat. Craig had asked how some of your respective organizations and other nonprofits and clinics are in your regions are pivoting their approaches and advocacy. But before we get into like others also answering that question, I want to go back to Evany because I know that y'all just kicked off a voting rights series at Positive Women's Network. And you kicked it off with talking about the importance of how in which you do in-district engagement with legislators. But you're going to continue this series as a way to continue to engage folks around the importance of being a part of this political process. And engaging in ways and making it and breaking it down to a way where it's easier for folks to do this. Can you tell us more of like why that y'all set up to do this particular voting rights series and why it is so important for folks to be trained up to do this civic engagement as our access to be civically engaged, our voting rights are being taken away in a lot of these states?
Yeah, so we, have been doing civic engagement work for years. Us, the Voting Rights Act, the redistricting, all of those things happening are even more reasons why we have to continue to do it. As we have been doing this, we understand that there are people that don't completely know what the importance of being involved in their being civically engaged means. So it is important for us to go out into our communities to educate our people. It is important for us to go out into our communities to hear and listen to our people because they're angry and they're righteously angry about what has been happening, even when they are involved. Even when they are involved, things like what is happening now still happens. All of those feelings and all of those people's reasonings are valid. People's feelings are valid. But we have to continue to talk to them about why it is important to not disengage, and because disengagement can lead to even further harm. So this education series is important because, again, we have to educate. We have to continue to educate people. It's not just a one and done. It's a continuation of things in order to make sure people are getting involved, to make sure people are being educated, to make sure people are looking to see before they go to booths that they're looking to see who they are choosing, because we know a lot of people just go into a booth and pick whatever name they've heard reverberate in commercials and on signs and things like that. So we really want to be intentional about making sure people are informed when they are choosing who to vote for. We also want our people to start running for local school councils, local school boards, local people in community. We want people to get engaged in that level as well, because we know that when people who have been impacted by a thing, they're more likely to make better decisions when creating policy and creating actions to move people, and that will impact people's lives. So our voting rights series is we invite everybody to, join, take a part, and I think challenge everybody, organizations, like everybody, all organizations should be doing some type of civic engagement work. And I think there is it shocks me that there is still a misconception that 501c3 organizations can't do civic engagement work. You can. You can't do C4 work, but you can do civic education. You can sign people up to vote. You can educate people about what's happening. Education is not telling somebody who to vote for or endorsing people. Education is education. That's what we do. And I challenge everybody in every organization to do that. But you all are invited to sign up. And I think our comms director is dropping it in the chat to join our civic engagement series. Thank you so much, Max, for uplifting that. I really appreciate it.
Absolutely no problems. While Michael did drop it in the chat, and shout out to y'all for putting that series together. And shout out to folks for also, as we could talk about all the things that people need to do, they also need to be trained up to do it. So definitely when you get a chance, tap into PWN's Voting Rights series and continue to promote it for folks to be able to do it. It's also an excellent opportunity for folks to join in the evenings, especially on the East Coast, early afternoons on the West Coast to join us. So that's a great thing to do. I also want to pass it on over to our friends Jada and Linda to also take a stab at the original question that Craig put in here, which was in the States, the due to choose no, sorry, missed the question. How are your respective organizations, perhaps some nonprofits, clinics in your regional network, pivoting in their approach to advocacy, prevention, and treatment efforts given some of these changes? And I'm going to add a piece because Linda knows that I did some work with One Voice in Mississippi, and you talked about the transparency issue, and we know about what happened with the TANF piece in Mississippi. And for folks that don't know, that's tax assistance for needy families, and how in which the non-transparency of that led to more and more Black families without access to the care that they needed. So, and can you also, Linda, if you can speak to any, like, since that is happening, how that's impacted Mississippi, but also what if shifts have been made or made to allow for some level of better transparency in the state in those type of decisions?
Matt, that was a dark time and place in Mississippi for Mississippi children and families who need resources the most. The lack of transparency and just you got to have the will to not do the right thing, just like you have to have a will to do the right thing. And that just didn't happen in that situation. But, I hope that was let me say this. I hope it didn't make things more restrictive and harder for people to get resources and for people to get the things that they need. We had, and I'll just say, loss of vouchers, with this new law and things that happened with Project 2025 for childcare. So, it's different things that are taking place that is removing, and I'm going to use Evany's safety net. It is truly removing safety nets from families, because you got to eat, you got to have a roof, you need a job, and so I think the transparency has yet to be seen, quite frankly. I think that, it's more restrictive than anything. And, I'm just, what was the other part of the question, Max?
What lessons learned are the pieces in order to make our folks be more transparent, but what also have you seen changes in the way in which people are advocating or even also putting in prevention treatment efforts in your local space, given all the changes that are going on, and what changes are actually working for y'all?
Well, I think the beautiful thing, and you name One Voice, and I'll uplift my organization, the Mississippi Center for Justice. I'm seeing that organizations are doing and being very intentional about civic engagement and tying issues to voting, tying issues to getting to the polls and policy making and decisions. With that, I've also seen greater engagement with implementation. We want to know who, what, when, where, and how, and to stay on it and hold people accountable. And it calls for more to have bigger shoulders because you have lots more to do. But I can see the light at the end of the tunnel. I can see the movement that's being made. People are hopeless. And so how do we turn that hopelessness into power to get people engaged, to keep them engaged? We tell people go to the polls. It's way more to it than that. And I was having a discussion with my colleagues before this webinar just about how do we, and I hate to say empower because it sounds like we don't have power. I'm going to say tools and resources. Tools and resources to help communities, the communities that we serve in. So I love that we've seen a greater level of civic engagement and it puts more information into communities. We hear things loosely, HIV criminalization, Medicaid expansion. What does that mean? And to really explain to people how that affects them and how it affects their communities.
Thank you so very much, Linda, for taking out also the time and space to answer that and understanding these intersections of when they start to take actual funds that are less transparent on some, it actually impacts all the other services that folks are also dealing with. And it's important for us to understand these different social determinants of health. And this actually ties me to one of our last questions. When you're seeing these federal funding disappear, where where did the organizations turn, and what creative pivots have y'all seen work? But I also want to add into that question, and this is being very transparent, as we all work with organizations that have much bigger budgets, have larger levels of staff, but are also under attacks during this time. How do we ensure that the loudest, most resource voices are not just the ones being heard, and actually the people that are directly impacted are actually also heard in these spaces?
I would say we have to ensure that those voices are in the room. So that might mean designing the room differently. One of the things PWN really believes in is we compensate people for their time all the time because we understand how important our people time is. We also hold meetings at times that are accessible for the people who we're looking for. If there are people who can only get on a call at 8 p.m. Central Time, then that's when we're going to have the call. We understand that providing transportation, providing childcare, interpretation, technology support, all of those things are important when trying to ensure that those most impacted voices are not drowned out or forgotten about. We want to make sure that we are sharing information with our community and our people before decisions are made. And not understanding that they have the capacity and the right and the knowledge to be able to help us make these decisions. I was just having a conversation where I was talking about the people who are closest to the harm, the people who people need to hear from the most may not always have policy language, but they often have the clearest analysis of what is wrong and how to fix it. So I think that is how we make sure, we have to make sure that we are meeting people where they're at and listening to their need. A lot of times people say we can't get these people to the table. Find out why you can't get them to the table. Why is it that they can't get there? And then help them troubleshoot and solve that issue.
To Evany's point, I think this is a time where we have to really, really be intentional. And I think we also, like I know in my organization, if I do this, like if I don't see somebody that should, I'm calling it out, right? Why are there no Black people in this coalition space? How do we change that? In fact, I remember when I first came to CHLP, some of you may know Brian Jones from Ohio, and they were making a steering committee, and I'm like, well, or a decision tree, excuse me. And I was like, well, Brian has to be a part of the decision tree because no one else from your coalition is Black. So Brian has to be a part of the decision tree for decisions that get made in terms of how we're going to move with our HIV decrim bill. So I think it also is incumbent on us to, when we see that folks aren't there and they're not represented in the room, to ask why. Especially like if I'm not organizing the meeting, like I want to know because they should be in this space. So I think that is important to try and make sure. And as Evany said, like I can't state enough how important it is to meet people where they are, right? Because sometimes those late night meetings is the only time that work for those folks. They have day jobs. They aren't a community organizer or an advocate by trade or by profession. And so we really have to be willing to kind of shift and meet them so that they can be a part of the conversation. I think that's crucial to our work. To your point about what are we doing when federal fundings are disappearing, I think we are trying to get creative, really trying to diversify funding sources. And like, yes, we fit into that category, and let me explain why. Uh, right? Like, oh yeah, we're an LGBTQ org too. I can tell you why. I qualify for that funding as well. That might not have been funding that we sought out previously, but I think it's important to try and think creatively, and also to share with our networks and organizations what is and isn't working, as well as we try and navigate these funding cuts and try and diversify our funding resources.
And I'll add that, you know, we need to continue, because I know all the organizations, we do create opportunities for communities to speak for themselves, to be at the forefront, and that means involving impacted individuals and families from the beginning of an issue or concern or whatever the case may be, legislation, and not after decisions have already been made. We don't do it without, of and for, right? We know that the value of working with people with lived experience often reveal problems and solution to policymakers and even to advocates, to us, that we would otherwise miss if we don't ask community for involvement, if we don't ask what it is that they need. And sometimes that'll mean stepping from the microphone, let them step up to the microphone, lead the meetings. As Jada said, this person has to be a part of this. I think this word has been used, I'm gonna say it again, to be very intentional about who's in the room. Everyone comes with different skill sets, and everybody may not have the cute language but we understand what people are saying, and we know how they feel about things. Just let them come up to the table, right? Advocacy is not how loud you speak. It's where the people most effective have engagement, power, opportunity to help shape a lot of these decisions. And civic engagement is a part of that as well. that's an extension of it. So being very intentional. I think it was Evany that said that, but yeah.
Thank y'all both for that. I wanted to give two things. One, I wanted to give, if Evany wanted to also have a final word of what does civic engagement look, what does like long-term civic engagement look like in places where they have historically tried to take that away? And what is like one key thing that people should think about moving forward? I will also think, as we are thinking about that level of civic engagement, and we have lifted PWN's training series. I also want to uplift the CHLP's abolition series they kicked off last year for folks to be able to be a part of as well. I also want to uplift a training series that Save HIV Funding is kicking off on the 18th, which is also the same day as PWN's birthday, to be also a piece to also think about some of the ways, and that is a C3 focused one, and then we'll have a C4 focused one later on in July. I know there is important elections today as a primaries in South Carolina, and there'll be runoffs in Georgia next week. All of these are important ways, but I also wanted, because it's only on time, but I also want to up to the CHLP work, and we want to celebrate all types of wins, but also the work that they did in Louisiana on the legislative piece around the HIV criminalization piece with that. And I also will say, if you want to learn more about the political determinants of health, Benita and I will be doing a political determinants of health workshop as part of the couch conversations that United We Rise is doing, and folks can sign up for that, and I will drop that link in the chat for that. But I want to give Evany the last word around, what does a civic engagement look like in these places, or no, better yet, what does sustainable civic power look like in the South, where they keep trying to make it hard for us, and they over police us and under resources? What can you actually highlight from PWN that's working that would be important for everyone else to think about what they should continue to fight on?
So, I want us to understand that, civic engagement is not something that we do only when we feel hopeful and we're happy. Civic engagement is what we do when hope is hardest to find, which is like right now. Hope is hardest to find. So in this moment, many of our communities at PWN, we have chapters, we have leaders in various states. They're exhausted. It's a lot happening. Where their healthcare is getting attacked. They can't get to the doctor. They can't get their medicine. Now voting rights are being attacked. My bodily autonomy is attacked. Where I live in Texas and everywhere in other states, public health infrastructure is crumbling. And the very organizations that have kept our communities alive for decades are, closing, being attacked, losing funding. All those things are happening, but civic engagement is how we fight back. Every phone call our people make, every person our people register to vote, every community member, every public comment we make, every story we share, every relationship we build, every person that we bring into this movement matters. And we are not able to stop every attack, but what we can do is refuse to be silent, refuse to be isolated, and refuse to surrender our power. The South has always been a place of resistance and resilience and movement building. So the question for us is not whether we have power. The question is whether we are willing to use it as a collective. This is a moment where organizing is so important. Leading is important. We know that the most impacted people are wanting to get involved. And the most impacted people will shape the future that comes next. So PWN is ensuring as much as we can that we are supporting the most impacted people in the state, in these states, to ensure that they're involved in every part of civic engagement or whatever it is that they want to be a part of. That's how we are dealing with this, and that's what we are doing. Thank you, Max, for allowing me to say that.
Thank you, Evany, for closing it up for us. Thank you, Jada and Linda, for taking the time out and continuing to be a part of this process and build out. Thank y'all for joining us to be a part of the first part of this SHIF series, Southern HIV Impact Fund, and this one particularly around how in which the intersections of health equity and civic engagement. Look out for more trainings coming up. Cliff will continue to uplift some of the other follow-up conversations around how engaged we talk about engaging funders, and also how we keep people in care during this time, during these attacks. Thank you again to these absolutely wonderful panel and for staying on with us a little bit after time. Thank y'all so very much, and continue to engage in some of our future conversations and different pieces coming up later this month and throughout the summer as we continue to